At the age of 7, it's clear that Ryan Piansky has a green thumb. In his backyard garden, he's growing beans, peas, broccoli, sunflowers, and corn.
I like corn. Corn tastes good.
And it's one of the few foods Ryan can eat. That's because he suffers from a little-known disease called eosinophilic esophagitis, or EE, a rare but increasingly common diagnosis for American kids. At birth, he seemed fine, but at 4 months, he started losing weight.
The pediatrician said it's probably just the texture of the cereal that you've started, don't worry about it. 11 months of age, he had fallen off the growth chart again. And then the vomiting got worse, and by his first birthday, he was in the hospital.
3 months later, he was diagnosed with reflux, but treatment didn't work, and his parents, both practicing physicians, continued their desperate search for help. After 2.5 years, they finally got an accurate diagnosis at Cincinnati Children's Hospital Medical Center. An endoscopic exam showed Ryan's esophagus was inflamed and swollen. A biopsy indicated high levels of eosinophils, white blood cells associated with allergies, but not normally present in the esophagus. Doctors put Ryan on a formula of amino acids, a liquid that would meet his nutritional needs without making him so sick. Most people find the taste of the formula intolerable, so bad that they can't drink it and must be fed through a tube. For many, the tube is uncomfortable and it must be changed periodically. It can leak or fall out, and the skin around it can bleed and be tender. While his friends at school are having lunch, Ryan is in the nurse's office filling up, and at home, eating is no longer a focus of family life.
We don't celebrate with meals, we don't go out to restaurants, but instead we do other family-oriented activities like taking a hike, going out to the park. It's a very different attitude.
And when birthdays roll around, there's one cake for guests and another for Ryan. Beautifully decorated, filled with tiny presents, but made from cardboard or Play-Doh.
When they're 4 years old, looking at you with those big teary eyes, and all their friends are having cake, that's very difficult.
The Hoban family has also struggled since their middle child, Kaylee, was diagnosed with EE. As an infant, she vomited every day, but the pediatrician told her mother not to worry. Like Ryan, Kaylee waited more than 2 years for an accurate diagnosis. And getting the formula Kaylee needs hasn't been easy. It costs about $1,000 a month. And at first, the Hoban's insurance company refused to cover it.
I remember talking to one girl specifically. I said, how about this? How about it's Friday, you don't eat anything all weekend, and I'll call you back Monday, and you tell me how you feel, because that's what's going to happen to my daughter if I don't get this formula by tomorrow.
While the formula allows kids with EE to survive, many continue to feel sick. At the age of 9, Sarah wisely missed 68 days of school. And when children miss school, their parents usually miss work. Doctors sometimes prescribe oral steroids to treat severe cases of eosinophilic esophagitis, but those drugs put patients at increased risk for serious medical problems, cause fluid retention, and psychiatric changes.
I feel very agitated and angry, and I get poofy, and I cannot sleep at night, and I just get frustrated all the time, and I'm never happy.
So Sarah and Kaylee don't take steroids, and Ryan's mother worries because he does. All 3 families are hoping scientists will find something to better treat EE.
The happiest moment of my life would be to see her on her birthday to eat her birthday cake, instead of just handing it out to everybody.
In the meantime, they take a cue from their children, who enjoy being with friends and learning new skills. They accept their situation with courage and hope for the day when they can enjoy food and feel good.